Well, cases of measles continue to increase here in Texas. The recent death of a young girl in Lubbock has certainly emphasized the potential seriousness of this virus. And we've asked our medical expert, Dr. David Winter of Baylor Scott & White, to give us an update. And Dr. Winter, I appreciate you joining us with the latest on this situation. Are we calling this an epidemic?
Oh yeah, it's a minor epidemic, but the more cases that we've seen in the past 30 years, I first want to tell people that vaccines are very, very effective. If you've been vaccinated, or if you had measles, you have lifetime immunity. Evidence of that, back in the year 2000, I want to remind people, measles was extinct in America. No transmissible cases for several years. Then 6 years ago, parents up in New York State decided not to vaccinate their kids. It was a minor epidemic there. Last year in Chicago, in an immigrant shelter, those people hadn't been vaccinated. They had a little epidemic there, and now we've got this one in West Texas. So measles is back because of unvaccinated people.
Yeah, it seems pretty clear that where the vaccinations go, measles does not follow. But when it comes to this illness, a lot of folks don't know much about it because we haven't had to deal with it in so long. So what do you tell your patients who have concerns and questions about measles?
Yeah, first, if you were born before 1957, there was so much measles around that you were extinct from needing a vaccine. You were fine. Now, if you had the early vaccine, the one made before 1968, it was a weaker vaccine. CDC's recommended that you get a second one. Standard recommendations for everyone, kids 12 months to 15 months get the first vaccine, second one between 4 to 6 years. Adults who haven't been vaccinated need 2 vaccines 28 days apart. So those are current recommendations. If you get those, you will have lifetime immunity.
Now, I've seen some numbers on the mortality rate from measles, but that's not the only concern here. There are significant other health issues that result from getting infected, correct?
Yeah, indeed, measles can cause encephalitis. A lot of kids that get measles are deaf after that, can cause pneumonia, and can lead to death. Most kids do pretty well with it, but there's some bad outcomes. So you don't want to get measles. You don't want your kids to get the measles.
Based on the numbers that you're seeing and what we know about vaccination rates and where they are now, what do you predict will continue to happen? Do you think we're going to continue to see a significant spike?
Yeah, I worry about that, Mark. It all depends on how many people are vaccinated. The authorities say if in a community less than 90%, some people say less than 95% aren't vaccinated, they're ripe for an epidemic. So right now, there's plenty of areas around the country where people aren't getting enough vaccines out there, so be careful. Spring break's around the corner. If you're unvaccinated, be careful in crowds because there's measles out there right now, and I worry about another epidemic in other parts of the country.
Well, it looks like unless those vaccination numbers change, we may be dealing with these kinds of things for a while. Dr. David Winter, I appreciate your insight this morning.
Thank you. Good to be with you, Mark.
As always.